How to measure size of a catheter? We will discuss the systems that are used to measure the catheter size and the units and what do they mean. We will discuss two scales, the French catheter scale and the Birmingham scale, who may also be known as British scale. French catheter scale will be our first focus. It is also known as French scale, French gauge, or Charrier system. It is named due to its inventor, Joseph Frederick Benoit Charrier. I don't have a French accent, but it may sound something like that. This system is most often abbreviated as FR, but less commonly also denoted as FG, FR, F, or CH or CH sometimes. All these abbreviations are in honor of its inventor, who was a French inventor. And the last two abbreviations are in honor of his name. The second gauge is Birmingham wire gauge. When the word simple gauge is used, it means Birmingham wire gauge. It does not mean French gauge. It is referred to as G or GA, which is also known as Stubbs iron wire gauge, or Birmingham wire gauge, or needle gauge system. But it is not Stubbs steel wire gauge. The first scale discussed will be the French catheter scale. This system measures the outer diameter of the tube, not the inner diameter of the tube. It has nothing to do with the inside of the tube. Second, you can see on the right side of the figure, this is the scale. With the increasing number, you can see the increasing size of the circle, also known as increasing diameter of the circle, as you can see in the figure. Its inventor, Mr. Charrier, devised it as a diameter times 3 relationship. Therefore, its formula is 1 FR is equal to 1 divided by 3 millimeter. 1 French gauge is 1/3 of millimeter. Thus, to get the value in millimeter, 1 millimeter will be equal to 3 times the French gauge. Remember, this scale has nothing to do with the inner diameter of a catheter and whether that catheter has 2 or more inner pipes. For example, if we compare a one-way catheter and a two-way catheter, both are the same size like 30 French gauge. The one-way catheter will have a greater size for draining, greater draining channel, greater size of pipe, inner diameter, than the two-way catheter, because the two-way catheter has to accommodate 2 pipes inside it. But the outer diameter of both the pipes and our measurement will be 30 gauge, French gauge, that will be same. The French gauge is used to size catheters and other instruments that are used in interventional radiology and surgery. For example, chest tubes. This scale has no predefined upper limit or lower limit because it is not a relative scale. It is a simple mathematical formula. We will get millimeter size outer diameter of the tube and we will divide it by 3 to get the French gauge value. So it can have any limit. There is no limit. It is limitless, sorry. The second one is the Birmingham gauge, also known as Stubbs iron wire gauge. It is also known as needle gauge system. We can simply refer it to as gauge or simple G or GA. It is an international scale used for sizing needles. This system was derived from a pre-existing system, a very old system, Birmingham wire gauge, also known as Stubbs iron wire gauge system. You can see in the figure, this was the scale that were used in measuring the wires. We will discuss a little bit of history. When making wires, we heat the iron and pull it through holes to make it smaller and smaller in diameter and a long wire. The greater the hole, the easier it was to pull the hot iron through that hole. And you can see in that scale, the number 1 is given to the biggest hole because it was easiest. The least amount of force was required to pass the hot iron through that hole. So 1 does not mean a small value. It means the smallest force that was required to make a wire, even though that wire had the greatest diameter. And the more the values are increasing, the size of hole is decreasing. The smaller the size, the greater force was required to pull that hot iron through that hole to make a smaller diameter wire. This system was adopted into measuring needles because they resembled wires. So the needle passes through as small the hole the greater value of that hole will be given to that needle size. So, greater the value of gauge system of that needle means smaller the external diameter of that needle, because values are reverse to the size. These values are directly proportional to the hole, they are directly proportional to the force required in pulling the iron through that hole. But the greater the value, the smaller the size, the smaller the hole through which that wire can pass. Birmingham gauge system is used to measure the outer diameter of hypodermic needles, catheters, which include peripheral venous catheters, central venous catheters, cannula, and suture wires. This system already has a predefined lower limit and upper limit. It has fixed upper and lower limit values. Its lower limit is 5 by 0 gauge or 5 zeros gauge, which is equal to 0.5 inches or 12.7 millimeter. 12.7 millimeter, also known as 1.27 centimeter. Its predefined upper limit is 36 gauge, which is equal to 0.004 inches or 0.102 millimeter, or also known as 0.01 millimeter. You can see that the greater the gauge value, the smaller the value in inches or millimeter, the smaller the diameter. So gauge value is opposite to actual size. Since there is no specific mathematical pattern like that exists for French gauge, so it is a very confusing system because it is a relative scale, not an actual scale. As already discussed, the diameter decreases with increasing gauge number. So greater the gauge number, smaller will be the diameter of that needle. Smaller the gauge number, greater will be the diameter of that needle. This system, which is used to measure the diameters of needles, has a link with the color coding system, so that colors symbolize the gauge values. But hypodermic needles and venous catheters have different color coding systems for the same gauge values. So a 15 gauge hypodermic needle will have a different color and a 15 gauge venous catheter will have a different color. First, we will link the color coding system of hypodermic needles with the gauge system. Like 16 gauge is white, 18 gauge is pink, 20 gauge is yellow, 22 gauge is black, 24 gauge is medium purple, and 26 gauge is brown. You can link some of these colors with the ones in the figure. The 16 gauge is white, and in the figure the white one has the greatest diameter. It is the biggest needle among these. Just like the brown one is the 26 gauge one, which is the smallest with the smallest diameter. So greater the gauge value, smaller will be the diameter, smaller will be the needle. Now we will study the color coding system of venous catheters. Venous catheters could either be peripheral venous catheters or central venous catheters. You can see the color coding in the diagram. The 16 gauge is the gray, 18 gauge is green, 20 gauge is pink, 22 gauge is blue, 24 gauge is yellow, and 26 gauge, that is not mentioned here, will be violet or purple. At some places it is mentioned black, so you must confirm it yourself. We haven't discussed the 14 gauge, which is shown in the figure. 14 gauge is orange. As we have already discussed that the gauge size is inversely proportional to the actual size of that needle. So smaller the gauge size, greater will be the diameter of that needle. So 14, 16 and 18 gauge needles have the greater size than the greater gauge values needles. So 14 gauge, 16 gauge and 18 gauge needles are usually used to rapidly infuse fluids or blood during surgery or trauma. This insertion is pretty painful due to its greater size of bore. High volume fluid resuscitation may be required for the trauma patient because they are in shock. They need blood rapidly. In which case, at least 2 large bore IV catheters are inserted, which are usually 14 gauge or 16 gauge. Some of the uses of the following catheters are discussed. 14, 16, 18 are used for rapid infusion in trauma and surgical procedures. 20 gauge needle, which is the pink one, is used for normal IV transfusion, normal blood transfusion. 22 gauge, which is the smaller diameter needle, will be used in adults, older adults and children. 24 gauge, the yellow one, will be used along with the children and elderly in neonates. Neonates are also included now. And the 26 gauge, the violet one, also known as the purple one, will be used in neonates. Thank you.